Hello everybody and welcome back to the YouTube channel. If you're here for the first time, hi, my name is Busari Maliayo and I'm a registered nurse. On this channel, I film content related to nursing and healthcare, and in today's video, we're going to be talking about the nursing care plan for peptic ulcer. Now let's quickly remind ourselves of what peptic ulcer is. Peptic ulcer is an ulceration in the mucosal wall of the lower esophagus, stomach, pylorus or duodenum. Let's not forget the mucosal wall is the innermost layer of the GIT, the duodenum is the first part of the small intestine, and the pylorus is the ending part of the stomach. Peptic ulcer is classified based on the location. If it's at the esophagus, it is esophageal ulcer. If it's the stomach, it is gastric ulcer. If it's the duodenum, which is the first part of the small intestine, it is a duodenal ulcer. One common thing about gastric and duodenal ulcers, which are the ones that occur in the stomach and the first part of the small intestine, is epigastric pain, which is a burning sensation, and it usually occurs after the person has eaten in gastric ulcer, and it occurs 2 to 3 hours after the person has eaten with duodenal ulcer. Let's get familiar with the diagnosis that we will be working on today. We'll be working on 3 nursing diagnoses today. The first one is acute pain related to NSAID use evidenced by verbalization. NSAID means non-steroidal anti-inflammatory drugs. The second nursing diagnosis is imbalanced nutrition less than body requirements evidenced by weight loss. The third nursing diagnosis is anxiety related to fear of the unknown, evidenced by patients expressing concerns about their current state of health. Welcome back. Now that we're familiar with the nursing diagnosis, now let's go into solving the care plan. Our objective for the first nursing diagnosis, which is acute pain, is that the patient will identify and understand and also be willing to take up pain preventive and relief measures after nursing intervention. Like the patient will be able to say, okay, these are ways I can prevent pain and I'm going to do that. Now to our nursing interventions and scientific rationale. The first thing is you assess the patient's pain level, the location of the pain, how long the pain lasts, what causes the pain, and what reduces the pain. And the scientific rationale is that you're obtaining baseline data and you're going to be able to diagnose the cause of the patient's pain. Is it food? Is it a drug that they have taken or something? Then is to instruct the patient to avoid the use of NSAIDs. I've said the full meaning of this earlier in the video, and examples of NSAIDs that the patient is to avoid includes aspirin and diclofenac. And the scientific rationale is that NSAIDs cause irritation of the gastric mucosa. The third nursing intervention is to instruct the patient to eat meals in a relaxed position and space meals at regular intervals. The scientific rationale is that when they eat their meals in a relaxed position, there is very little risk for them to aspirate. Then when the meals are in regular patterns, there is less risk for the gastric mucosa to be at risk of exposure to hydrochloric acid. When the person doesn't eat so much, the gastric mucosa is exposed to hydrochloric acid that is always present in the stomach. Lastly, you encourage the client to stop smoking. That is if the patient has been smoking before, and because smoking results in increased acidity of the gastrointestinal tract. Now moving on to the evaluation. Don't forget in your evaluation it must be reflecting that your objective was achieved if it is an exam, so that you don't end up missing out marks for saying that what you did not achieve your initial objective. So evaluation is that the patient identified, understood, and was willing to take up pain preventive and relief measures after nursing intervention. Now to the second nursing diagnosis. The second nursing diagnosis is imbalanced nutrition less than body requirements evidenced by weight loss, and our objective is that the patient will achieve cessation of weight loss within 1 to 3 days of nursing intervention. Now moving to our nursing interventions. The first thing is to obtain a nutritional history of the patient and a list of preferred meals. And the scientific rationale is that you're going to get baseline data. You want to know what the patient has been eating in the past, how much the patient has been eating in the past, and getting a list of preferred meals will help you to plan the patient's meal. The second intervention is that you help the patient identify food that can cause gastric irritation, and the scientific rationale is that gastric irritation could lead to loss of appetite. Definitely, you need to avoid that. You don't want your patient to be losing appetite. So once they don't eat food that will cause gastric irritation, then there is lesser risk of loss of appetite. Next thing is to help the patient create a meal plan for his or her condition, and you also have to take into consideration their culture and food preferences when creating a meal plan. And the scientific rationale is that having meals that the patient is familiar with and will not cause irritation will help him maintain adequate diet. You're eating food that will not cause gastric irritation, and there are also food that that you can relate to, possibly because of your culture or your ethical background. That way you get to eat well. Then the next thing is to encourage the clients to limit intake of caffeine and alcohol, and the scientific rationale is that alcohol causes gastric irritation while caffeine causes increase in gastric acid secretion, and those are two things you want to avoid in a peptic ulcer patient. Now moving to the evaluation. Evaluation is that the patient achieves cessation of weight loss starting from first day of nursing intervention. If you notice, my evaluation still falls within the time that I put in my nursing objective. Always take note that you must not exceed or go below the time in your nursing objective. Now, the last nursing diagnosis we're working on is anxiety related to fear of the unknown, evidenced by patient expressing concerns about current state of health. And our objective is that patients will demonstrate reduced anxiety within 30 minutes to 1 hour of nursing intervention. Now let's move to the nursing interventions and scientific rationale for this nursing diagnosis. The first thing is to assess the patient's level of anxiety, and the reason for doing this, the scientific rationale, is that once you know the extent of the anxiety the patient has, the nurse will be able to know which method of communication to employ. Do you want to talk to the patient privately? Do you want to include their family in the conversation? Then you know which method of communication is going to be best. The next thing is to encourage patients to express concerns and ask questions. The rationale is that when you have an open communication with your patient, it will help you develop a trusting relationship. The patient will be willing to listen, they'll be willing to open up, and then the communication is going to be effective, basically. The next thing is to answer all the questions your patient asks you truthfully and in simple languages. Like, you don't have to use so many medical terms while you are answering the questions. And the rationale is that once you address the patient's concern in a way that they will understand, it will reduce anxiety and they will understand. It's better to use simple English words for those who have proper understanding of English language. And if the person doesn't really understand English language, it's something that you can get someone else to interpret in the language that that particular patient understands. Finally, you have to provide emotional and psychological support for the patient. And the rationale is that once you give emotional support, once you give psychological support, the patient's level of anxiety will drop. Now, moving on to the evaluation, which is that the patient's level of anxiety was reduced. Patient demonstrated reduced anxiety at 30 minutes of nursing intervention. Alright, I hope that was simple enough. If you enjoyed this video, please give it a thumbs up. Subscribe to the channel for more videos like this, and I'll see you in my next video. Bye.